So a few take-home points and I'll stop. I would encourage you to track down the prenatal records. If you didn't create them yourself, you may already know what that diagnosis is, and if you don't go through that extra step, you're at a disadvantage. Once you've discovered one abnormality, please do not assume it's the only one. There may be others, and I've showed you some examples of that. You see what you look for. And I'm referring to a few things here. If you think you may have a fetus with esophageal atresia, look for the dilated proximal esophageal pouch, or you'll never see it. You have to actively seek it out. And if you think you might be dealing with a fetus or newborn that has some sort of abnormal connection between urine and meconium, look for bowel in the lumen, calcifications in the lumen of bowel by ultrasound or on radiographs. If radiographs suggest that the obstruction is more distal, meaning the air-filled loops fill the belly, I would encourage considering doing an enema before doing an upper GI to avoid the problems of fake out. If you must do an upper GI because the emesis was green and the baby's very sick and you're really concerned, just be aware of that fake out that can be created, distorting the superior to inferior position of the DJJ in that situation. And do remember, midgut volvulus is an absolute surgical emergency. If you can't image for one reason or another, or if you're not sure about how to interpret what you've done, you're obligated to urgently go to the OR to avoid the lifelong complication of loss of bowel to ischemia. And I think that's it. Thank you very much. And I'm happy to take questions.